Hi, I'm Lori Byron, a pediatrician who's cared for kids in eastern Montana for the past several decades.
And I'm Rob Byron, an internal medicine specialist who's also cared for patients in southeastern Montana for most of the past several decades. And together we are co-hosts on Our Planet, Our Health, featuring conversations with people from across Montana. Most of our guests are healthcare professionals who work to protect our health and safety, increase people's awareness of the impacts of air pollution and climate change on our health, and to address air pollution and climate change themselves. But health is important to all of us, not just healthcare professionals. So some of our guests are professionals in their own rights, but not healthcare, who work to protect our health and address the issues of air pollution and climate change.
So today we're honored to have Jenna Solomon here. And Jenna works with Riverstone Health, and she is an expert in public health. And we're going to be talking to her about her role in public health and what it is and how it affects our community and how climate change affects our public health. But first, maybe some funner parts of discussion. Can you tell us where you grew up and what your family was like and what you learned as a kid that influences you now?
Yeah, well, thank you for the opportunity to be here. I'm excited to be here. I grew up in Santa Cruz, California, which is about in the middle of the state. It's right on the coast, beautiful beaches, but I grew up in the Santa Cruz Mountains, so about 20 minutes from the beach in the Redwood Forest, which is absolutely breathtaking. So I was very privileged to be surrounded by such beautiful scenery at school, traveling to and from work and things like that. So that's where I grew up. I was raised by my mother and father, and I have an older brother as well. We were pretty involved with sports and various community activities like youth groups and things like that. And I was very aware from a young age that I grew up in a drought, and California was in a drought. And while I didn't quite understand what that meant, I knew that it meant we didn't have maybe as much water as we thought, or more so that water is a precious resource that we don't have an unlimited amount of. So from a young age, it became pretty apparent that taking care of our natural world, taking care of the resources that we have, especially those that are finite, is very important. Also being from California, every summer we had the threats of wildfires, and there's been times where folks who I care deeply about have had to be evacuated, and some who have lost their homes to wildfires. So I grew up aware that the world we live in is not always shaped by the decisions we make, but by those natural forces that are much greater than many humans. So I'm very privileged to have grown up there. I'm very privileged now to be in Montana, in a beautiful place, in different ways, but nonetheless beautiful. Yeah.
So Jenna, you talked a little bit about your family, but it's very different coming to Montana, which is obviously a much more rural and much smaller population than California. Start to fill in some of the blanks for us a little bit, and particularly the whys.
Yeah, so I actually grew up in a pretty small town. When you think California, you might think San Francisco, LA. I grew up about an hour and a half south of San Francisco. Santa Cruz is a pretty small beach community. Compared to Billings, I couldn't even speculate on the numbers. But it's not a huge city like that of San Francisco, like that of Sacramento and things like that. In my high school, my graduating class was about 176, so pretty small compared to some of those larger cities. And because I grew up in the Redwood Forest, there was some rurality, there was some limited resources. My mom is a healthcare provider, she's a physician, and actually the reason they ended up in Billings was for my mom's role at Riverstone Health as a residency faculty member and physician at the clinic. But for my mom in particular, it was really important to kind of educate the next generation of healthcare providers. She was one of a few healthcare providers in our little Santa Cruz Mountain community. So she was everyone's doctor. She was all my friends' doctors and my teachers' doctors, and very tight-knit community, which there's definitely some comfort in moving from California to Billings because it has a very similar feel, even though it's a different area and different community. But yeah, it was just always very apparent to me that not everyone has the same experiences and opportunities to achieve good health, to make decisions based on what's available and what's around them. And so where I grew up, there was a few smaller grocery stores. We had one Safeway, which is the same brand as Albertsons. So even though it wasn't as big city as you might think, it feels, now that I'm here for a couple of years, it feels like it's very similar in what options were available as far as seeking healthcare, as far as recreation activities, and things like that. Being closer to places like San Francisco, we were maybe a little bit closer to some of those larger city things than perhaps we are here. Yeah, I still feel like I kind of got that small town experience, even though I did come from a state that has a lot greater of a population than Montana as a whole. So, yeah.
So we got a little taste of your family from your mom being the one of the few physicians in the area. But what do you think you've carried over into your adult life, like important things that your parents taught you that became a part of you?
So I have vivid memories of my dad in our showers at home. We would have those 5-gallon buckets that collected any water runoff, and he would use that to water the plants. And so I think there's been a very clear role of taking care of our community, both physically and with people, but also the nature and the environment that we live in. Not leaving trash behind, cleaning places, leaving places cleaner than when we found them. I had the privilege of doing some camping trips when I was younger, and so just an appreciation of being outdoors. My dad absolutely loves to be outdoors and hike and walk, so we got to spend a lot of time hiking and walking and enjoying the redwood forest and the state parks that California has to offer, and being a steward of that. It's not there for me to do with it what I want. It's there for me to enjoy and appreciate, and in theory leave better, cleaner than my time with it. So we spent a lot of time outside, and it was definitely important that we take care of that it's a privilege to have access to those things, and it's one that not everyone has. So I really loved the opportunity to grow up in such a beautiful place, but then to be able to enjoy that beauty that it has to offer, and also be able to contribute to it in ways of minimizing my human role in it, since I am a visitor of this land, and it will exist long after I am gone. And so my role as I'm here, hopefully living a long, wonderful life, is to take care as much as I can and improve the world around me as best as possible.
Well, thank you for sharing that and those sentiments particularly. So spend a little bit of time of talking about what was your education track, or where'd you go? What happened?
Yeah. So from a young age, just with how I was raised and what I saw, I knew it was very important to me to pursue some sort of career in social justice. So I went to school at the University of Colorado in Boulder, another beautiful, beautiful place, to pursue a degree in political science. And through that, I found a little bit more in line with public health through the means of public policy. My mom being a physician and having the knowledge that she has shared about health and the things that we can do to take care of ourselves. I didn't want to be a physician. My brother's actually, I call it, he's in surgery school, so he's a second-year resident to be a surgeon. That just didn't feel like my track. I was really drawn to the social justice aspect of it, the community aspect of health. So it started with political science, because it's through the systems that we live in that we are really given the opportunities we have, and the decisions that are made for us by people centuries ago, decades ago, and happening now influence our abilities to take care of ourselves in a number of different ways. And it was through that public policy, that political science work, that I was kind of introduced into the field of public health. And for me, once I sat in my first global public health course, it was just like an aha moment. It's taking sociology and biology and epidemiology and political science and public policy and all these things that interact together to create what people experience as it relates to their health. So once I found that public health was a thing, I was very fortunate because not everyone has their like, aha, this is what I want to do with my life. And I was very fortunate that it happened for me while I was in school, already pursuing a degree that I knew I wanted to do. I knew I didn't want to be a lawyer like many of my classmates, and I knew I didn't want to be a politician, and that health and social health was really important to me, and so it was kind of the avenue that brought all of those things together. And I actually recently finished my master's in public health through Boston University. It was an online program, actually focused on health equity, which was really cool. In the midst of my college experience, the COVID-19 pandemic hit, and so that kind of shifted gears for a lot of folks. I had planned to study abroad the summer of 2020 in, I think, Puerto Rico for some community health tract, but as you can imagine, that was canceled. And so rather than doing the study abroad opportunities that I had, I knew I still wanted to pursue public health, and I knew I wanted to explore that in a way that was safe and available to me at that time during the midst of that pandemic. And so I was very fortunate that I was able to, my parents had already been here, they moved here in 2018. I was still in Colorado, but I was able to come and live with them for a couple months, and I was actually doing the COVID testing that Riverstone Health started. It was at the Shrine first, and then it moved to United Way. So my first introduction to working in public health was really like a global pandemic. And I learned a lot through that. I made a lot of great connections with the people I worked with, but it was a really great introduction to how, as individuals, we all experience health in different ways, and education about health and learning why certain outcomes happen. So it was definitely a great learning experience, and it reiterated that I was in the right place doing the right thing. So when I graduated the following year, I knew I wanted to continue my career in public health, and that just so happened to be continuing with Riverstone Health.
Cool. So as a prevention coordinator, tell our audience what you actually do in public health and how climate change relates to that. I think a lot of people wouldn't see that connection.
Yeah, so public health is kind of the unsung heroes in healthcare. And our doctors, our physicians, our nurses, they are fabulous and we need them. But the lens that I think we in public health look at is, what if people didn't get sick? What if there weren't exposures to things that we know can cause cancer or respiratory illness or other challenges that people deal with? So as a prevention program coordinator in our world in public health, what we try to do is create opportunities for which people can seek better health, therefore to avoid illness in the future. One of the courses that I took in college was environmental policy, and I thought it was really interesting that the EPA, for example, it wasn't created because people wanted to clean up our climate and make our health, it was created in part of that, but it was also created in response to a growing concern in respiratory illnesses and poor air quality that as a community, as a society, we decided we didn't want to allow our citizens to get sick on things that we could prevent. And so that was, of course, in the 70s, and we've come a long way since then. But the innate nature of health experiences leading to changes that can result in people accessing better health in our healthcare systems. So what we do, my role in particular, I oversee some of our tobacco prevention work. We know that tobacco is the leading cause of preventable death worldwide and in our country. We also do some suicide prevention work, substance misuse prevention, and then we also do things to promote physical activity and better nutrition. Those things all, in theory, when practiced, reduce the likelihood of illness as one ages. So again, our healthcare providers are vital in treating illness, but the way we see it, what if what if people didn't get exposed to things that cause those illnesses in the first place? So I take a lot of pride in creating programming or providing education to young folks that can give them the tools to then make better decisions for themselves. So that's just kind of a brief snapshot of what we do in the prevention program, but there's a lot of other things that happen in public health too.
Yeah. Jenna, thank you for that. And one, I want to point out to our audience, for those that aren't aware, is that Riverstone Health is one of the backbones of the healthcare in Billings, Yellowstone County, and the whole surrounding area. And it has been for a long time. And we've all talked about it, and you talked about it a little bit just now, but what's the difference between my walking into a physician's office and say, I think my blood pressure's high, or I need my cholesterol checked, or ask about whether I need a flu shot or not, and public health?
Yeah, so whereas a physician sees an individual as their patient, in public health we see the community as our patient. So we're not looking at a specific individual's weight, for example, but what are the rates of obesity in our community? So we look at it from a little bit of a higher lens, and we think about ways that we can create opportunities for a wider net of folks to experience better health. So I'll use the tobacco prevention example because that's what I'm pretty well versed in. As mentioned, we know tobacco is the leading cause of preventable death in our country. It can lead to lung problems, heart disease, addiction. It can lead to disrupting the development of our brains, especially for younger people. So one of the things that we do is educate our youth in the dangers, particularly as it relates to vaping. And this is a very specific example of how we try to prevent illness. We know that if people consume tobacco and nicotine products, they're at a much higher risk for a number of ailments. So if we can give them the education before they start using, or when they're early in their use to stop using, they're actually putting themselves at a better path. And the way that's different than going to a provider and saying, yeah, I've been smoking for 30 years, or I've been smoking for 10 years, and the provider saying, well, you might want to stop. We try to prevent the behavior that can lead to the illness so that in theory, you don't have to see as many patients in the future. If we did our job perfectly, no one would be sick, with the exception of what we know is naturally occurring in our communities. But the behavior-related illnesses that occur would in theory be decreased. And what's interesting with the tobacco work is we also know that there's an incredible environmental impact that it has. There are tons of water that have to be used to transport tobacco products, to make tobacco products. We also are seeing a rise in wildfires and things as a result of vaping devices that are exploding. And so it's really interesting to see how these things do interact with our natural environment, because what we know can have a negative impact on the human health likely can have a negative impact on the environmental health. And if we see that there's areas where our environmental health is struggling, we can speculate, and what we've seen time and time again, that human health is also struggling. So it's been really interesting to see how all these things kind of come together, and the roles that we have in trying to reduce the negative impacts that things like, for example, tobacco use might have on our communities and the world for that matter.
Thanks. So you and other people at Riverstone have done a number of things that connect the dots between climate change and air pollution and human health, including the flags and the floor banners. Maybe you can explain to the audience what those things are, or what other projects that you all have done.
Yeah, so our air quality flags, of course, we've worked with you to get those, but basically it's a visual cue, that we have. We have a flagpole on the corner of our building, and I believe twice a day our facilities folks check the air quality, and there's a color associated with the level of air quality. Green being the best, yellow being starting to get worse, red, purple going to be the most dangerous. And so we're fortunate that when I look look outside of my office, for the most part, I see a green flag because we do have a pretty great environment here. But there have been days, in particular in the summer during heavy wildfire season, that we do have those yellow, orange, and red flags that come up. But it's an indication to our community and those who drive by that if there's worse air quality, most of us are at a greater risk for experiencing poor health outcomes. That could even just be a sore throat or a little bit of a cough, but some folks who might be at higher risk, who have asthma, who are pregnant, it's important that they're able to see those cues and say, oh, I should probably stay inside if possible. So that's just an example of our air quality flag program. It's been really cool to see how that's been adopted and used. And there's a little sign, a little plaque at the bottom at the flagpole that kind of shows what the different colors mean and how you might protect yourself during the event of worsening air quality. And then we also have worked with you guys to get floor banners. So we have topics that are pregnancy and climate change and health, and community health and climate change, and a variety of different topics that we have around our campus that kind of, for those who come by, for those who are there for the pharmacy, for appointments, or just passing through our campus for a number of reasons. It's just kind of education that lets folks know that our health can be deeply influenced by the health and of the environment around us in the form of air quality, lead in pipes and things like that, as another extreme example. So we've been able to implement those, and one of the coolest things that I've been able to be a part of is actually a recycling program at Riverstone. So we have a lot of PHI, personal health information, that needs to be in locked places and then disposed of in a very specific way. We can't just toss it in the garbage because that's important information that needs to be kept secure. So we do have to work with a contractor who takes that PHI and shreds it so that no one's information can be used. But what we came across a few years back was that a lot of non-PHI material was ending up in there because we didn't have another place for, a misprint of something to go and be recycled. We only had the PHI. And so we were able to reduce our cost of PHI disposal by increasing the recycling of just regular paper. We also were able to increase the recycling of cardboard. There was a lot of cardboard that ended up in the trash because we didn't have places around our campus for people to dispose of it. And so that was a really cool project that I worked on as part of a small team at Riverstone to make sure that people know that there are recycling options and then where to find those. So that was a really cool program, and just a couple of the things that we're doing to inform our community that the health that we experience as individuals can be intrinsically linked to the health of our environment and the world around us.
Thank you. And Lindsay, you talked about it with the, and I'm sorry, Jenna, that in the healthcare sector, mostly hospitals, but also clinics and individual offices, we actually are responsible for about 8 to 9% of greenhouse gas emissions that contribute to climate change. So at every level, things that we can do, as the changes you have highlighted, can make a big difference so that we aren't contributing to worse health for the people we're supposed to be helping, which is a big point. A couple things to ask about. In Montana, and you mentioned it before, wildfires is a big issue. And also, even though we're in the very northern parts of the U.S., so is heat in the summer. Are there any programs you're aware of to help people, I'll say, prepare or do something when those issues come up?
Yeah, so we do keep an eye on weather advisory and weather warnings. If we do see that there's a heat advisory or extreme cold too, we do try to communicate that with, these are things that you can do, keep a kit in your car for the winter, should anything happen that has extra food and extra water. With heat, staying inside as much as possible if there's extreme heat, or wildfire smoke. Some folks might not have access to the best insulation in their homes, and so having programs that allow fans to be distributed and air filtration opportunities, as well as working with our community partners. A lot of the work we do, we can't do it alone. We work with community partners closely, and so being able to identify cooling shelters, for example, or spaces where people can escape extreme heat, wildfire smoke, or extreme cold are just some of the things that we do to try to keep our community safe, because these events we do know cause ailments, they can cause deaths, and as much as we can, we try to avoid that by preparing our community for things that might happen before they happen, letting them know what they can do to mitigate some of the negative impacts that are going to come with those weather events, because they're happening more frequently and more extreme now than they were 10 years ago, 20 years ago, and so on. So a lot of what we do is working closely with our community partners to ensure that there are emergency protocols in place for the events that those occur, but then also just general information of this is what you can do to keep yourself healthier in the event that we have extreme heat. These are the people that are at most risk, outdoor workers, for example, in those events. And so just trying to get that information out there so that an individual can choose decisions that in theory improve their health, especially in the events that those weather events happen. And they do happen.
Yeah, that's great. Thank you. So there's just a couple minutes left, and we'd like to give you an opportunity to tell people in our audience. I think we all care about our health. I think a whole lot of us care about climate change. Maybe more people care today when they realize there's a connection between climate change and their health. What advice or what would you like to summarize for our audience?
I think one of my favorite things that I actually heard you share was that climate change is one of the greatest team sports or team events that we can work on. And I think that's absolutely true. As individuals, we have a role in reducing our impacts. And that could be trying to bike to work or walk to work, or even just if you have a soda pop shop and you want to go, maybe take a walk or a bike ride when it's nice out and you're able to, rather than a car trip. We know that those reduce our CO2 emissions. But then also being able to communicate with others and to be aware of how our climate and the weather events that we experience can influence our health. When we are spending a lot of time in smoky air, we are going to experience at least throat and lung discomfort, and there are people who are at greater risk. So being aware of how those things can impact us and being able to mitigate those challenges. And then being aware that what we do is we look out for the best of our entire community. When our community's healthy, we do well. Our economy thrives, and a number of things improve. So it's not just the individuals that are responsible for taking care of themselves, but as a whole, as a community, what can we do to make sure that the majority of our people are taken care of, and that we have solutions for those who are unable to care for themselves for a number of reasons.
Fantastic. What a great response. Thank you very much. And thank you all for listening.